Yeah.
I just wondered if you did any measures on the parents' participation or their adherence to your protocol with their children.
We didn't do good measures in that study. We have sort of a vague therapist compliance rating, but we hope to be able to do this again larger scale with real adherence measures. Yeah.
I want to go back to Tom's question, but I guess looking at the data that you have in the circle there, because you had a couple of slides like that.
Yeah.
And the basic message is that if you're behaviorally inhibited, but the parents don't have psychopathology, then you're less likely to be at risk for psychopathology yourself as a BI child. Is that right?
I think so, but look at how small this cell is. I mean, the problem, it's not a significant interaction, and I would love for somebody to do a study where they pre-screen the parents for absence of psychopathology, but still recruit inhibited kids and see what happens to them.
Right. Well, that's why I sort of, going back to my earlier point, suggesting that the different methods of recruiting of BI may in fact be contributing to these different patterns of binding, so that recruiting kids at age 2 with behavioral inhibition may draw, just as you showed in your Venn diagram, may draw for families who are have a history of psychopathology, and recruiting kids at 4 months when it's whatever the infant is doing may not. And so those may be your children of controls, and the others are your children of
Right. Right. I mean, the only other thing I can think of to add is that it may be something environmental. We know that there's nothing about exposure. We have data that there's nothing about exposure to the parental psychopathology that makes them have BI, but there may be something about exposure to parental psychopathology that makes them have anxiety. And I'm just thinking that there may be something along those lines operate. I mean, because there's also a finding, Jordan Smoller found a candidate gene for CRH to be related to BI much more strongly in the panic offspring. And one possibility is just that it's more genetically related to panic, but the other is that something the panic parents are doing is actualizing the vulnerability in the gene to make the child look BI. So there could be something going on like that. Yeah.
Okay, I was just curious, did you have numbers on whether parental psychopathology was also affected by the intervention?
Sorry, by what? By whether?
The intervention. So I know it was focused on the children's anxiety, but did you have any numbers on whether parents did maybe?
No, we didn't re-interview the parents fully, and also much of that was lifetime diagnosis. Very few of them were actually acutely anxious. We did try to get the parents, it was a very low-funded study, and we tried to get the parents to fill out something like the Beck anxiety inventory afterwards, and very few of them did. So we couldn't really tell.